Hi, my name is Emma Nye, and I'm a Doctorate of Athletic Training student here at Indiana State University, and I'm going to talk to you about my practice-based research project. The goal of my research project is to evaluate the effectiveness of cupping therapy on low back pain and health-related quality of life on women's volleyball players at Indiana State. Now, you may be asking why. Well, because 62.5% of those athletes reported to the athletic training room last year complaining of low back pain. We know that low back pain has both physiological and psychological implications on patients. Athletic trainers must do something to mitigate this epidemic, and perhaps cupping therapy is the key. Now, I plan to achieve this goal by evaluating patients that come into the athletic training room, determining if they are eligible for cupping therapy, applying the intervention, and tracking patient outcomes using a questionnaire, the Oswestry Low Back Disability Index, and the Global Rating of Change. Now, why is this important? Clinicians are using this Chinese medicine technique without knowing if it's effective. Now, if we can make a difference on pain and function for student athletes at Indiana State, we will. But how will we know if we are if we don't evaluate the interventions we're applying? Myself, as well as my fellow clinicians, apply these cups to patients almost every day. But perhaps we can choose a different modality that has better outcomes. Or maybe this intervention is the key to positive outcomes, but we won't know unless we evaluate. Now, this advances athletic training through two main pathways. First, if we as a profession are striving for third-party reimbursement, we must prove that what we do works. And secondly, if we want to provide whole-body health care, we must think about patient values and track patient outcomes, which is a vital component to this study. Now, let's not forget how this project benefits the patients. If it's effective, we anticipate seeing positive changes on both questionnaires, indicating that cupping therapy is helpful to these patients in everyday life as well as in sport. In order to provide the highest level of healthcare, we must use high-quality interventions. And in order to make a meaningful difference in our patients' lives, we must make sure that they work and they're safe. My practice-based research project aims to answer the question of how.